Hey there guys, this is the review of the medicine paper and important topics that should be studied before the upcoming paper. The medicine paper. First of all, we'll be starting with the renal system. The list of important topics in the renal system includes the causes of acute interstitial nephritis. You also have to remember the pathology behind it and what are the biochemical markers in cases of acute interstitial nephritis. Hepatorenal syndrome, the types of hepatorenal syndrome and the etiology behind it. Again, the same thing for renal tubular acidosis, the types of renal tubular acidosis and what are its causes. The causes of high anion gap acidosis. This question has been asked time and again, so this question should not go wrong. You should remember the causes of high anion gap acidosis very well. Nephrotic syndrome in general and minimal change disease in particular. You have to study in detail about Liddle syndrome, Bartter syndrome, Gitelman and Gordon syndrome. You have to remember the various electrolyte imbalances occurring in these cases. Abg analysis, the analysis of the arterial blood gas. You may be given a scenario with a particular values of PCO2 and the bicarbonate levels, and you'll have to make a diagnosis on what kind of acidosis or alkalosis the patient is in. Next, coming to the pulmonary system, you have to have an overall view of the interstitial lung diseases. You have to study cystic fibrosis very well. You should know everything about cystic fibrosis, right from the genetic mutation that causes to the treatment options that are available with us. Bronchial asthma is again a very important topic and its comparison with COPD. The management of bronchial asthma is very important and it should not be missed. The various treatment options we have and the particular side effects. Pneumonia is again an important topic, especially the pneumonia severity with the Curb 65 scoring system. You have to know about pulmonary thromboembolism and the ECG and X-ray changes that are associated with it. Next, coming to CVS, you have to know about pericarditis, acute pericarditis, the various type of JVP waves and the particular disease conditions where they are found, the type of heart sounds, the abnormal heart sounds and which conditions do you see them in, the pulse characteristics and abnormalities. This question has been asked quite often and you should know the abnormalities of the pulse very well. Then there are certain characteristic named murmurs and you have to know the diseases in which they are seen, in which they are heard. Rheumat, especially Wegener's granulomatosis, very important. This is a 5-star topic. You should do it very well. Churg-Strauss disease, Takayasu arthritis, Kawasaki disease like in peds as well, and ankylosing spondylitis. In GI, Crohn's disease and ulcerative colitis, a comparison of these two you all must have done. So just give it a revision. Read a little bit about giardiasis and the malabsorption syndromes. In CNS, read in detail about subarachnoid hemorrhage. Read particularly the causes of bulbar and pseudobulbar palsies and what clinical features each of these have. The various type of dementias and the clinical features along with the pathologic findings in dementia. The differential diagnosis of movement disorders and Parkinson disease in particular. Also read a little bit about Parkinson plus syndrome. The various type of aphasias and how to differentiate, how to clinically differentiate between these different type of aphasias. Cauda equina versus conus medullaris, again a very important topic, and read them by a comparison. Next are some miscellaneous topics like cytomegalovirus and HIV infections, causes of syndrome of inappropriate diuretic hormone release, diabetes insipidus, diabetic ketoacidosis, causes of primary hyperaldosteronism, pheochromocytoma and adrenocortical carcinoma, thyroid diseases, just an overview about hyper and hypo conditions as well as the drugs that are used in management. Drugs are very important in this case, and Behcet's syndrome. This is the overall view of the ultra important questions for medicine, and these are the ultra important topics that you should not miss by any chance. I hope you're all geared up with the best of your preparations and I wish you all the best. Thank you.